Briefing is the most practical skill in crew resource management, because the idea is that you have skilled people on your crew, on your team, and briefing is your opportunity to make sure that they are all working together. My name is Bill Schuler. I'm a retired orthopedic surgeon, and I am the Director of Training for Safer Healthcare. A good briefing has two components, a cultural component and a situational component. The cultural component is really a social time when the team leader makes sure that he knows the names of each one of the people on the team, which is very important to each one of the team members. And it's a time to draw the team members into the procedure so that they not only understand the organization of what we're going to do, but they also take ownership that this is really a procedure that they want to have the very best outcome possible. Now, the second part, the situational part of the briefing, is a time to explain the steps, what comes next, so that all the people on the team will not only know where we are in the procedure, but what they can expect to happen next. Briefing is a huge opportunity for the team leader to set the tone for this case or for the day, and to make sure that all of the team players are on the same page. In other words, to make sure that the whole team understands what it is that we are here to do. Anyone that has questions has an opportunity to ask those questions and get answers. Anyone who has another opinion would have an opportunity to bring that opinion up, so that once we start on the project, the team is all working together with one voice. Briefings is a huge skill, and it's a very easy skill to learn. As I go out to hospitals, to operating rooms, to observe and to coach, the first time that a surgeon tries to do something new with his team, like a briefing, it's awkward. It's uncomfortable because it's not something that they have done as a team before. However, the second time, it's not nearly as difficult, and by the third or the fourth time, it flows very easily. So it's a skill that team leaders can pick up very quickly. Probably the hardest part is changing the mindset about whether or not we need to do a briefing. That is the real challenge. Once the team leader agrees that a briefing can be of value, not only to the team and the patient, but also to the team leader himself, then the actual skill of briefing is something that they pick up very quickly.